Hello, everyone across the country. I'm Tim Phillips, President of Americans for Prosperity. Thank you for joining us for another of these Facebook discussions with key leaders in the Congress as we work to stop this terrible multi-trillion-dollar spending bill that Speaker Pelosi and President Biden and Chuck Schumer are trying to force on the American people. It'll raise taxes. It'll bring in elements of this terrible Green New Deal and of union power grabs and a lot of Bernie Sanders Medicare for all, which of course we know is socialized medicine. We have an important guest with us today, a member of Congress that we really are thankful to work with. And as I continue out on the road, today I'm in Nevada. We're doing a big event, grassroots tonight, to urge Senator Cortez Masto to vote no over in the Senate on this, along with the two Las Vegas area members of the Congress, two Democrats. Then we'll be in Cedar Rapids tomorrow, and then Dallas, Texas on Monday in Congressman Colin Allred's district, a member of Congress, a Democrat who's from, frankly, a moderate district, and he should not be thinking about voting for it, but he is. Anyway, all that said, John Tidwell, our Oklahoma State Americans for Prosperity Director, please introduce our guest and let's get started talking today.
Tim, thanks, my friend. I appreciate that very much. It's really my honor to introduce a good friend of mine, a good friend of AFP's, Representative Kevin Hern from the 1st District of Oklahoma. Congressman, thanks so much for being here. You are a member of the very powerful Ways and Means Committee, which gives you a very large purview there in Congress. And I know that one of the big focuses that you've had here in the last several months is really focusing on healthcare. Clearly, we have this is a really almost a do or die time in the United States Congress in terms of spending and where our nation is going. But you've talked a lot about in the past, and I'd like for you to kind of give us some more information on these healthcare reforms that you've been focused on, that the Republicans in Congress have been focused on, working on in committee. Where's that going? Why is that so important in the very big picture?
Well, I think, first of all, thanks for having me on, Tim, John. Thank you very much. It's great to see you all. It's always great to talk to people who care about limited government and protecting our freedoms here in this great country that we live in. It's been an honor, as you mentioned. I sit on Ways and Means. I sit on the Tax Policy Subcommittee, Worker Family Support, and also on Social Security. And we know there's a crisis in all of those. But also one of the great honors that I've gotten here lately is that Leader McCarthy asked me to chair the Republicans' response to the healthcare issue, the Healthy Futures Task Force, to chair the subcommittee on affordability. And obviously, we know that the issue of the cost of healthcare rising has been, just been a catastrophic event. We knew it was 2 or 3, 4% increases prior to Affordable Care Act. And that's why today we jokingly but seriously call the Affordable Care Act the Unaffordable Care Act, because we've lost doctors. Doctors don't want to get in the business. Providers are always concerned about reimbursements. There's an all-out attack on Medicare Advantage. The Democrats are trying to destroy what we do as far as creating the greatest pharmaceuticals in the world that others get and preserve life. And so now we're looking at this from the perspective of, what is it that we can do to empower consumers? And, it's like the old bell-bottom pants and the old, the shag carpets. If you wear it around long enough, it always comes back to that people will make the best decision if you empower them with their own money. And I really borrow that from a great friend of all of ours, the late Senator Tom Coburn, who got me interested in politics some 20 some odd years ago. And when the Obamacare idea was being kicked around, he said in 2007 and created a plan, actually, with the thought that the American people were smart enough, if given the opportunity to use their money, to pick a plan that best fit their needs. And much like as he laid out, that if you were able to see all the plans for homes and cars and life insurance, you could also equally do that if you're given the opportunity with enough competition out there through the health insurance programs or even association type plans. that you could take care of your health and you could be accountable for it, and that there would be a reckoning through your health based on, you know, what you did in your lifestyle. And why we don't today, a person who is reckless with their home or their car pays a higher premium than those who are not. And the same thing would apply in the health insurance world. But right now, what's happening is we're seeing a lot of prices being driven through a lot of government regulation. And so we're working hard to get behind the scene on that.
Yeah. Congressman, in this bill that Speaker Pelosi is trying to jam through, you know, this reconciliation bill, it looks like they want over $5 trillion. There are a lot of elements of Bernie Sanders' Medicare for All and expansion of Obamacare. I know you've been battling that in committee. Can you give folks a sense of what we're talking about when we say that? What it means when they're expanding elements of government-run care using this legislation, if they're successful?
Yeah, so I think we go back. I worked feverishly when I was in the private sector with McDonald's Corporation, working for the franchisees and as a franchisee, looking at the impact of the Affordable Care Act on business. And in 2010, to see what that was going to happen. If you recall, we had 30 million Americans not employed or not in a health plan. And today we have some 27 to 30 million again. So that's not happening. Nothing's happening in the right way. We still have around 170 million people in the private sector. But I think the two most critical things that we have to look at, and I'm one, what I've seen since I've been here is don't believe what you hear, wait to see what you have to vote on. There's a lot of people say, well, this is not going, it's not good. People are talking about it, but it's not going to be in it. And I'll give you those two. One is lowering the Medicare entry age to 60. I mean, if you're going from 65 to 60, that's going the wrong direction when you consider that our nation, our people are living longer. We should be going the other way if we wanted to preserve the monies that are in there and the issues we have with the lack of funds. For all the listeners, if you look at this whole idea of having a checking account and a savings account, our savings account is running low and lower and lower, and we're taking money out of that to write the checks. And around 2025, 2026, that money is depleted. And so if we don't do anything today, there's going to be at least a 21% cut for benefits across the board. That's if we do nothing. So we have to get after this today. The other end of this is, so we're going from 65 down to 60. The other end is for all the states, whether they've done it through ballot initiatives or through a legislative process, and you've done Medicaid for all or Medicaid, expanded Medicaid, we're increasing that number. I mean, in Oklahoma alone, it's just enormous. We've got about 7 states left. This bill would mandate those 7 or 8 states that are not Medicaid, expanded Medicaid, would have to do so at the behest of the federal government. So now then, we're down to a very narrow gap of where the government is continuing to squeeze. And going back again to Senator Coburn, he said that when the Affordable Care Act, then if it should pass, it will be a pathway to single payer. And that's exactly what we're going to see. That's the mission today. And quite honestly, one of the big problems we had, and I've talked to a lot of big companies, there weren't a lot of companies early on that were really excited about having the government do their health care programs. And a lot of small businesses couldn't provide health care. And so people had to get health care some other way. Well, today, because of the Obamacare and Medicaid expansion and private insurance, pretty much every American should have health care if they want health insurance, rather. And so what's happening is that we're losing all of our business support, and we've got to make sure our businesses stay with us in fighting this single payer. Because if we don't, once we lose it and the federal government takes it over, it's just another big program. And we'll never have private insurance as we know it today. And some will argue, well, we'll have universal insurance like the British healthcare system. And I've talked to people from Great Britain, and it's horrible. It's the same thing that we're seeing in Canada. If they want a surgery scheduled, they come to the United States of America and use our system, not theirs. So we have to fight back on this. We have to keep those 170 million people in the private sector insurance on board and grow that, and not lessen it. And another thing in there, we're going to have fewer cures. They wanted to crush the pharmaceutical companies and have a penalty of 95% tax on their gross income if they didn't acquiesce to what the Democrats wanted to have happen. And I pushed a simple amendment that said we would push back on these rare disease. I have a niece. It's actually my sister passed away. I have a niece. Another sister has spina bifida, and these children, these folks across America that are having these rare diseases, if there's not a big universe, these pharmaceutical companies just simply will not develop these pharmaceuticals to protect this life. And I know we are all pro-life, very strong pro-life, and we're very pro taking care of those who have unfortunate diseases after they're born. And this bill would destroy that opportunity.
Congressman, you've talked about the layers that exist between a patient and their doctor, between somebody who's seeking care and a final positive outcome. What kind of pushback are you getting in working to increase that transparency, that competition, but eliminate those layers? Because there's so much. You could be sitting in a doctor's office having a conversation with your doctor, but there's so much that exists between you and that individual on paper. Talk to us about that.
Yeah, that's funny you bring that up, John, because I can almost see the humor in your question of asking me. I know you're doing it a serious way, but you and I've talked about this a lot. One of the things I learned when I first got here, the healthcare problem in the United States of America was somebody else's. It was always pointing the other direction. And I think the way we fix that is we put the power back in the people, the ability to go pick and choose and see through all of this. But it's their own fault, actually. If you go back when I was younger, my country doc in the hills of Ozarks, he was my primary doc. He was also my network provider. If I had something he couldn't do, he sent me someplace, and he knew that me or my family were good for the bill. And we lost that along the way until we started making that separation. And being the great entrepreneurs we are in the United States of America, there are people who came in and filled those gaps. And so we've got to go back, and it's much more difficult to put the onion back together and get back to where we were than it is to, sit here and just continue to peel layers off. So we're working hard on that. I think a lot of this goes back to the empowerment of the people. And I'll give you one example of that is you get to see the bill before everybody else sees the bill.
Yeah.
You think about this, you finally get the EOB, the explanation of benefits, after everybody else has said what they will pay and won't pay. Right. And this is what you're left to pay. And that shouldn't be that's not the way it is on anything else you do. And so we've got to make sure that we're starting to get back to individual responsibility and accountability.
Ladies and gentlemen watching, you can learn more about Americans for Prosperity's health care positions and ways that we're trying to do what the Congressman's talking about. Empower individual Americans to have greater say in their healthcare decisions for them and their loved ones and their family members, and preserving freedom, access to good quality care, but again, freedom. Socialized medicine, I think about that. My mom is 85 years old. She's on Medicare, worked the 4 to midnight shift for many, many years to take care of our family. She relies on it. If we pull the private insurance away from 160 or 70 million Americans who have employer-based insurance, and we throw those people onto Medicare, then folks like my mom are going to have a Medicare that doesn't work anymore. Because if you have Medicare for all, you've got Medicare for nobody. And we know that. The idea that you're going to add 160 million people, dump them into a federal program, and it's going to all work out, we know better. And that's one reason we're working so hard to preserve freedom and choices. And yes, Medicare for seniors like my mom. But Congressman, as we wrap up today, would you tell folks what your vision is? We've talked about the stuff we're trying to stop, a lot of the stuff in this bad bill that will bring socialized medicine. Give us a sense of where you would like to see Medicare and private insurance go for our country moving forward.
Well, I'm a huge proponent of the free markets, and I think Medicare Advantage is a great example of that. And I will tell you, the Democrats are doing everything they can to kill it. We had a Ways and Means markup 2 weeks ago, and I had a whole list of percentages of Medicare available patients in each member's district. And there are a lot of members' districts that are over 50, many are over 60% of their eligible patients that are in the Medicare Advantage program. And so when many of my Democrat friends were trying to kill it, I went down one by one, asked them what they were going to tell those seniors who are on Medicare in their districts. And none of them had an answer, because they want to completely ignore that. This whole thing, and this, you mentioned it about individual freedoms. The whole fight that we're going through on every front up here right now is about centralized control in Washington, D.C. Whether it's your health care, your education, your tax policy, where all the money just gets sent to Washington, D.C. Everything's a focus on this idea that everybody's smarter in Washington, D.C. than individual. And we have to be careful about that. I know in your travels across the country, you're talking that, you're giving that message everywhere. And it's the same fight we've been fighting since we started this great experiment called the United States of America. And we need to fight it every single day, because it is stronger today than it has ever been in our lifetime. This fight for the individuals in each one of our states to push back on the federal government.
Yeah. Congressman Kevin Hern, I could hear the buzzers going off. I know you've got to go do your job, and goodness knows, as important as these votes are right now, we don't want to keep you from that. So thank you, right in the middle of a big week in Congress on Capitol Hill, for you to take a few minutes with us. Thank you, sir.
Yeah, thank you very much.
You all have a great day. Thank you.
Appreciate it.